Hey everyone, Jack here from Health and Balance. Hope you're doing well and having a good week so far. Hope you've also had a chance to watch last week's video here on the Glenarrow Health Hub, where we talked about this month's Facebook topic of lower back pain, gave you a bit of a background, and I hope you had a chance to implement some of those lifestyle factors that we talked about in terms of breaking the chronic pain cycle as well. This week, we're going to have a little bit more of a closer look at exercise, in particular strength exercise, and the relationship that shares with chronic lower back pain. For this week's video, I want you guys to get involved from an exercise sense. So if you have a Pilates mat or something of that nature, roll it on out, pause the video as we go along, and I want you guys to have a go at some of these exercises we're going to demonstrate today. Other than that, let's get started. So a lot of you guys out there who either have previously or currently experiencing chronic lower back pain, you might have heard that from a strength exercise point of view, the most beneficial thing was going to be to strengthen your core and your lower back muscles. And if you've ever been to a gym and you've been in a group class and you've been yelled at to switch on your abs or brace your core, and you've never really had any understanding of what that actually means, that's what I want to talk to you guys today about. So that brings us to the topic of lumbo-pelvic stability. So lumbo-pelvic stability is basically your or an individual's ability to maintain a neutral pelvis and a neutral spine posture when completing either upper limb or lower limb dynamic movement. So basically being able to put your pelvis in a nice safe position when we're moving in general and moving our upper and lower limbs. Studies have shown that those people that have chronic lower back pain typically have really quite poor motor control within this musculature, and the people that have poor control in these musculature typically have higher occurrence of chronic lower back pain. There's two main muscles that contribute to lumbo-pelvic stability. I'm going to put a picture up on the screen now. I want you to see how to go if you know what they are. Alright, so gold star if you got the answers right, but I'll give you the answers anyway. The anterior, or the muscle at the front, is called your transverse abdominis, and the muscle at the posterior, or the back, is called the multifidus. These are two deep muscles lying either side of the spine that contribute heavily towards lumbo-pelvic stability and keep your lower back in a safe position when you're moving. And so the reason why I want to talk about lumbo-pelvic stability today is that improving lumbo-pelvic stability is going to benefit anyone that's experiencing chronic lower back pain. Now, how can we test if we have good lumbo-pelvic stability? I'm going to run you guys through a nice simple test that you can do at home right now. So to assess your lumbo-pelvic stability at home, we're going to need a wall, and that's it, okay? So I'll run you through it now. You're going to pop yourself up against the wall with your feet maybe about 30 centimeters away. And what you might be able to see, if we put our head, shoulders and bum up against the wall, most of us might be able to fit our hand between our lower back and the wall, okay? So to engage those muscles that we're talking about, your transverse abdominis and your multifidus, what we need to do is pull our pelvis up until our lower back becomes in contact with the wall. So you might want to use your hand for a bit of feedback initially. Think about having a drawstring on the top of your pants there. We're pulling it up and our lower back pushes into our hand. If you're finding this really hard, move your feet further away. If you're finding it quite easy, move your feet until your heels are almost up against sort of the architrave there, okay? Give that one a go now, guys. So the movement that we just completed there is actually called a posterior pelvic tilt, okay? And that engages those two muscles that we talked about before, the transverse abdominis and the multifidus, and it's gonna lead to better lumbo-pelvic stability. If you found that exercise quite hard, you weren't quite able to get your lower back quite up against the wall or press into your hand, I'd like you to practice that exercise from now into the next week. Conversely, if you found that exercise quite easy and you got the hang of it quite quickly, I'm going to give you guys some progressions that we can try throughout the rest of the week. So the progressional exercises that I want to give you guys who found that exercise quite easy up against the wall are going to start to incorporate some of that upper limb and lower limb dynamic movement that we discussed before, and it's going to challenge your ability to maintain that lumbo-pelvic stability as we have the limb movement occurring. Here are the exercises now. Two exercises I demonstrated there, the first one being a bird dog and the second one being a heel lower on your back, are two exercises that are going to challenge your lumbo-pelvic stability. As you might have seen in the videos I just put up then, I want you to get some sort of feedback when you're completing those two exercises. So for the bird dog, you can place some type of ball or something that's going to roll on your lower back region. Making sure that doesn't fall off is going to ensure that you're maintaining your lumbo-pelvic stability, not rotating or having too much extension in your lower spine as well. Similarly, when you're on your back doing the heel lowers, using your hands, it can be a cushion or something like that, and making sure that you are pushing your spine up against the floor will ensure that you're maintaining that lumbo-pelvic stability as well. So research has shown that improving lumbo-pelvic stability can have a positive effect on those with chronic lower back pain. A lot of the studies used an 8 or 9 week exercise program and found significant decreases in pain intensity for chronic lower back pain population. And so apart from adding those 3 exercises into your gym or home program, I'd also like you guys to be a little bit more aware of your lumbo-pelvic stability just from now until the next week as well. That can be when you're doing your activities of daily living, when you're walking around or standing in place. I also want you to be aware of it when you're doing your other gym exercises as well. So whether it might be a squat or a standing bicep curl or whatever it may be, having a think about the positioning of your lower back and then engaging those musculature to put yourself in a nice safe position to complete those movements. So see how you go with those 3 exercises, guys. As always, if you have any questions or comments, get in contact with the clinic. If you have a concern if it's the right exercise for you, you can get in touch with us and we'll let you know. Otherwise, have a go at those exercises, guys. I hope you've gotten a little bit out of today. Look forward to catching up with you next week. Take care.